Senator, there is widespread bipartisan agreement that programs like Medicare, Social Security, and Medicaid are the main drivers of our rapidly increasing national debt, now approaching $20 trillion, as you know. Without reforms of these programs, they say that we're heading for a debt crisis. You have the Congressional Budget Office, among others, projecting last year that spending on these programs and interest on the debt could consume all annual tax revenue by 2031, meaning we wouldn't have money for national defense and poverty programs and education and the like. You have a big tax increase planned, but you also plan to spend some $18 trillion on programs. So how do you prevent a debt crisis?
Okay. Number one, of that $18 trillion, much of it is being spent to have the United States join the rest of the industrialized world in guaranteeing health care to all people. And what that means is that, in fact, the average middle-class family, see, what that $18 trillion supposedly does not include is the fact that that middle-class family in the middle of the economy would save about $5,000 a year on their health care costs. That's part of our Medicare for All program. I happen to believe, and I know not everybody agrees with me, I believe that health care is a right of all people. I believe that there is something wrong when we are spending...
Excuse me, where did that right come from in your mind?
Being a human being. Being a human being. And what I believe, Brett, you may disagree with me, I believe that if she is poor and you are rich, she is entitled to the same quality health care that you have because she's a human being. But in any case, when we talk about our health care system, this is important to know. It's not just that we have 29 million people without health insurance, and that we have many more who are underinsured, and that we are getting ripped off big time by the pharmaceutical industry, who are charging us the highest prices in the world, but that we end up spending, and you can explain it to people, maybe. Why do we spend 3 times more than the British do per person for health care? Why do we spend 50% more than the French? And why do we pay the highest prices in the world for drugs?
But, Senator, you're talking about health care there, but my question was about the federal debt. Currently, we're at $19.1 trillion.
Yeah.
The latest CBO baseline shows gross federal debt projected to rise by $10 trillion by the end of FY 2016, and the end of 2026, $29.3 trillion at the end of 2026.
But, Brett, I raised the issue because of that 19 that you were talking about, 15 was for health care. And if you exclude that, then let's talk about the others. I happen to believe that in the year 2016, when we talk about public education, it means to me that a college degree today, in many respects, is what a high school degree was 50 years ago. So when we talk about public education, I believe that we've got to make public colleges and universities tuition free. I believe that we have to substantially lower student debt because young people should not be forced to pay off their debts for 50 years. Now, how do you pay for that? That's your question. You know, when the illegal behavior on Wall Street caused this country to collapse into the worst economic downturn since the Great Depression, the United States Congress, against my vote, Hillary Clinton and I disagree, she voted for it, I voted against it, but in any case, Congress passed a bailout. Well, you know what I think? I think right now we should impose a tax on Wall Street speculation. I think it's Wall Street's turn to help the middle class of this country pay for public health.